like to welcome Christopher Friends, who is CISO at Interfaith Medical Center in New York, who will be presenting a great session, a highly informative session. Chris and I have co-presented in the past, so I can attest he's always got something new to share and something insightful. Chris today will be talking about the need for evidence-based security. So with that, over to you, Chris. Thank you for agreeing to present today.
Thank you for having me, and good afternoon, everyone. Today I'll be talking about the need for evidence-based security. And to kick things off, there's a current paradox in cybersecurity that we should kind of all be a little alarmed about. One of the things that we're seeing is that cybersecurity spending is increasingly going up, but so are data breaches, ransomware attacks, and other negative security trends. So one of the questions we need to ask as cybersecurity professionals is, why is this? Why are we spending more than ever before on cybersecurity, yet negative outcomes are still also increasing? I think it's time to really start to evaluate what we're doing wrong, what we're doing right, and take a very different approach to security. The current approach for security in healthcare is largely compliance-based, and many organizations are highly concerned with how compliant they are with HIPAA and other security standards. But one of the problems with compliance is that compliance and security are often two different things. There are numerous illustrations of how you can easily be compliant, but still be horribly insecure. I kind of view compliance as a minimum benchmark and not an end goal. If you're shooting for compliance alone, it's kind of like trying for a D grade in the classroom. Yes, you may check all the boxes. Yes, you passed the class, but it doesn't necessarily mean you're doing a good job. One of the recent things that actually illustrates this in great depth is the recent change to the NIST password standard. A lot of you may be familiar that NIST recently updated their password standard to recommend choosing longer passwords that are infrequently changed, as opposed to changing passwords every 90 days. Now, for years and years, it was a compliance standard.
Chris, I just want to interrupt you there. Your PowerPoint is not showing up. You might like to reshare that.
Sure.
There we go. Perfect. Thank you, sir.
Okay, just go back a slide so people can see. So compliance and security are not the same thing. And as I mentioned, it's kind of like going for a D grade in the classroom. And to illustrate this problem, let's go back to the NIST password standard. One of the things is that the NIST password standard was recently changed to recommend no longer changing your password every 90 days. They now recommend a longer password that you infrequently change. And the idea behind this was when somebody actually took the time to look at the compliance standard and the effect it was having, it was actually showing that the frequent changes were actually producing a less secure outcome because people were picking much simpler passwords so they could remember them. Now, if this is a long-term compliance standard, something that a lot of organizations have done for a long period of time, it makes you wonder what other compliance standards are out there that are really actually producing poorer security outcomes than we would desire. So I think it's time to start to begin to change the approach we take to security. I'm not saying compliance is a bad thing, but I think we need to incorporate more evidence-based approaches into how we do security. We shouldn't rely on compliance alone and just do something because a checklist tells us to. We should really begin to evaluate that the security controls within our environment are actually working to improve security, that they're actually working to make us more secure against cyber attacks and other possible outcomes. A lot of cases, if you're just focused on compliance, for instance, yes, you may have put that firewall in place, but if you've never tested to actually ensure that all the rules are properly in place, that there's no misconfigurations, how do you really know that that firewall or other control is giving you the security you think it is? We need to take a more testing and more empirical approach to how we do security. I think it's time that we as an industry begin to develop metrics around security controls to ensure that controls, additions, and changes we make to our environment are actually working to make the environment more secure. In essence, it's really time for security to become much more of a science than the art form it currently is. A lot of the approaches I've been taking in recent years have used this type of approach. One of the approaches I really like to take for doing this evidence-based security approach is to start with a quantitative risk assessment framework, something like FAIR, and use that to identify the greatest threats to my particular environment. Once I identify the threats, I like to actually develop metrics to quantify the impact a threat could have, develop metrics to measure the efficacy of the controls I have in place against that threat, and develop controls as well to measure our incident response efficacy if one of those threats were actually to materialize. once I have all the metrics developed and in place, one of the things I like to do is then develop a way to actually simulate whatever threat we face. And we're going to walk through this process in a minute using a mock ransomware attack. So have a way to actually have a way to actually simulate the threat and use that simulated threat as a way to actually go ahead and collect those metrics. And that's going to give us a really empirical way to actually see what controls are working in our environment, what controls are not working in our environment, and possibly what controls are actually counterproductive to security and actually make things worse. So it provides a way to actually measure and see what's effective within our environment. So you can then simulate the threat, you collect the metrics, and you analyze those metrics to see what the deficiencies were. Then I'm a really big proponent of actually putting your remediations in and repeating this cycle of testing and measurement by re-simulating the threat to actually then empirically measure that the remediations you made actually worked to make you more secure and are not just checking a box. And a lot of examples of this, by doing this approach, you can learn a lot of interesting things. For example, let's take a use case where you have a pen test against a web server that your organization has public facing. Now, in a traditional environment, let's say the pen tester gets into the server because the patch was missing. One of the things that they may do to remediate the outcome is apply the patch. Now, I'm not arguing you shouldn't apply a patch. You should always patch any vulnerability that you come across. But if you start to collect metrics like this, it may come to light that the bigger problem actually is not the fact that that web server itself is compromisable, but the fact that that web server could be used as a trivial pivot point to compromise a bunch of other systems within your organization. So yes, you should apply the patch. But if you look at metrics like this, you may see that it may be even better use of resources to actually start to begin to make that particular server a much less trivial pivot point within your organization, because there's always going to be another potential 0-day or missing a patch around the corner. So taking an empirical approach can often change the perspective of how you actually approach security. And it can often help you target where your biggest vulnerabilities and your biggest risks actually are. So this is an approach that I've been taking for quite some time. And one of the examples that we're going to go through today is in 2015, I kind of saw the writing on the wall for a ransomware attack eventually hitting a hospital. So one of the things I was very interested in doing was using this approach to simulate a mock malware outbreak within my organization to actually show how mass malware would actually impact the hospital that I work for. One thing I will mention before I get into the process that we followed is the AHIS, the Association for Executives in Healthcare Information Security, their incident response committee, which I chair, does make this particular exercise available as a guide on their resources page. So for anybody interested in more details on this, they can easily follow this guide to walk through step by step how this particular exercise I'm going to discuss is done. Now, one of the reasons I'm very big on mock incidents, in addition to some of the evidence-based approach that I've touched on already, is they really help you to identify weaknesses in your incident response plans. One of the things is a lot of organizations have an incident response plan on paper. They never really take the time to go through it. And when an actual incident hits, you're going to find there might be all kinds of holes in your response plans where different people don't know how to respond to different things, or certain technologies fail. So one of the best things you can do is actually go ahead and actually test your incident response plans to actually ensure there's no major holes, that everybody knows how to act accordingly, and so on. Additionally, as already mentioned, these exercises can really help you to identify deficiencies in security controls. If you actually simulate an incident, see what it's like, it really gives you a great idea of what controls work and what controls don't work. And as already mentioned, they can really help staff to ensure they can effectively and efficiently respond to an incident. The more and more you drill incidents with your staff, the better their response time is going to be, the more the damage is going to be mitigated, and the better the outcome is going to be for your organization. Now, just a quick overview of the incident response process for anybody unfamiliar. There's a preparation phase of the incident, which ideally occurs pre-incident. This is where you make all of your incident response plans and lay them out. Then there's an identification phase in which you identify that an incident is actually occurring within your organization. You have a containment phase where you work to put measures in place to mitigate the spread of the incident further. Then you have an eradication phase where you eliminate the threat from your environment, and a recovery phase in which you restore your environment back to normal operations. But the most important phase of all of these is typically the lessons learned phase, which is usually done post-incident, and it allows you to look at the process of preparation, identification, containment, all the various steps, and say, what could I have done better in order to improve the outcome for next time, or in order to prevent this incident from happening again. And one of the great things about doing a mock incident is you get to walk through all of these processes and pick up a lot of those lessons learned before a real incident actually hits your organization, which makes you better prepared for when that real incident comes. So one of the things, as I mentioned, that we were really concerned with was how could ransomware actually impact the hospital at which I work? So we decided to simulate a mass malware outbreak. And to do this, we made use of the EICAR test file. Now that's this weird but harmless string of characters represented there. So EICAR test file, completely harmless string of characters. If you execute it, it'll just print EICAR standard antivirus test file to the screen. But the interesting thing about this particular string of characters is that years and years ago, all the AV makers got together and agreed to treat this particular file as a virus. So it provides a relatively harmless but effective way of testing antivirus within an organization. So as part of this incident, we wanted to evaluate several things, including how well our AV software would be able to detect the outbreak, how quickly staff would identify, respond to, and contain the outbreak. So what we did is we used this as a basis for our testing. Now, before I go into more details, one thing I will mention is that when we did this exercise, it was known to myself, the CIO, and the CEO of the organization. Not one other employee, IT or otherwise, was looped into the fact that we were conducting this test. So we could actually get a very real world idea of how the organization would respond. So to simulate the outbreak, we took the EICAR test string and we incorporated it into a Perl script in which I authored. So what the Perl script did is it took a copy of the EICAR test file and it attempted to copy the EICAR test file to each PC within the organization and then use PS execute to try to execute the EICAR test string. And in most cases, this would result in the antivirus in that particular machine being set off. And as mentioned, this script was executed without the knowledge of anyone else in the organization other than 3 people at the very top. Now, this is just a screen here of our antivirus console at the time, and you can see a bunch of PC names, and you see next to them virus/spyware detected. So the script is starting to run at this point, and it's starting to spread the mock malware through the organization. So we're starting to really learn about how our defenses work to keep this contained, how it can spread through the organization, and we got some pretty interesting results. First, I'll cover some of the good things that we saw. One, IT staff members were able to identify the outbreak, track down the source of the infection, basically the PC running the Perl script, and they were able to remove that PC from the network. And we also learned that many of our in-place security features did work to stop the spread of the infection to parts of the network. Network segmentation, which at the time was ACLs between VLANs, was actually highly effective at keeping this contained. We'll come back to network segmentation in more depth in a few minutes. One of the other things that we learned is that some of the configuration differences between desktops. Our VDI desktop image was done by a different engineer than our physical desktop image. And one of the things we learned is that certain configurations in our VDI desktop image actually made those more resistant to this attack than the configuration that was on our physical desktops. So we're able to actually compare the 2 images and use that to further harden our desktops. So we learned a lot of good stuff by doing this, but often more interestingly, it's actually the bad stuff that you learn the best lessons from. So some of the things that were on the negative side is while the incident was detected and contained, response time could have been improved. Yes, IT and IT security did find the machine, but it would have been much better if they could have found it faster. And this may not be surprising to anyone who has experience working with doctors or nurses, but one of the things that was kind of alarming to see was that we had all these AV prompts going off on a lot of PCs, doctors and nursing stations, and no normal user actually bothered to call the IT help desk or anyone within IT to actually report that all these AV prompts were going off. So these were some of the not so good lessons we learned that we had to address after this exercise. So to kind of recap about some of the changes we made based on the good and bad that we learned from this exercise, one of the things we did is that in order to improve response time, we actually modified the configuration of our AV software a bit to make the outbreak more noticeable to IT staff. The main thing we actually did was we began to actually hook the software to our ticketing system so that rather than just an email going to IT generically, it began to open tickets in staff members' name, and that was shown to give a much better response for future things. We did a lot of internal training, both with IT staff as well as with non-IT staff, to really push how security is important, and with the non-IT staff to particularly reiterate how cybersecurity and patient safety are linked in a modern hospital and how it's something they need to pay attention to. And a lot of the great things that also came out of this was that after doing this exercise, a lot of IT staff members actually positively responded to the security department because it was kind of eye-opening for them that they now really understood why security was insisting on certain practices that IT was a little resistant to do prior to this. But with one of the things we're going to focus on for the rest of the talk is how, based on the results of the network testing, we actually saw that network segmentation was really effective. But one of the things that we learned was that network segmentation, very good at containing it, but at the time we were segmented by department. And one of the things that we learned by doing this is that if we were to lose an entire radiology department, or if we were to lose an entire clinical department of some form, it was still going to be disastrous for the hospital. So even though we were a segmented network, we learned by actually measuring it and doing this exercise that we weren't really segmented enough to meet our organizational risk tolerance. So that really gave us the impetus to begin to move to a more zero trust model. Now, zero trust enforces the creation of a perimeter around every network-enabled device to ensure that only pre-approved traffic flows are allowed to occur. Basically, it's the equivalent of kind of sticking a firewall in front of every device. And if a communication is not needed between device A and device B, that communication is blocked by default, as opposed to the very flat networks that are common in a lot of healthcare environments. In zero trust environments and the high level of network segmentation they require are an ideal way to help mitigate the spread of malware and other security threats, because that communication is likely not even possible due to anything non-essential being blocked by default. So this is kind of the model we decided to strive for. And I'll go into a little bit of how we actually chose to approach zero trust. We were one of the really early hospitals to actually go down the zero trust road. We started our zero trust journey in end of 2015. And at a high level, the steps we took to zero trust were first to identify all the information systems. We next then chose to identify the data flows between those information systems. Once we understood how data flowed between those systems, that became the basis for implementing our network segmentation policies. And once again, because I'm so big on the evidence-based approach, once we actually began to implement zero trust and put all these more fine-grained network segmentation rules in place, we repeated the testing along with the mock malware outbreak I talked about, as well as other red team exercises, to really demonstrate that the network segmentation we're putting in place was actually effective in helping the organization. I'll go through these a little more in depth now. So the first major challenge for zero trust, as mentioned in some of the previous talks, is asset management is a big, big thing. It's the first step in doing zero trust. It's a great exercise whether you decide to do zero trust or not. You have to really map out and identify where all the assets on your network are. And as mentioned in some of the other talks, this is an effort that really needs to involve more than just IT. You're going to find there's a lot of assets that are not under the direct control of IT. You may have finance sending data to external vendors. You may have shadow IT you discover doing this. There's all kinds of information assets that you will uncover by running through this process. And for healthcare, this has to include IoT devices, including security cameras, medical devices, printers, all kinds of devices that you find in the network. You want this to be as complete as possible, this particular asset inventory. Now, the asset inventory itself is a time-consuming process. But if you are going to go down the zero trust road, the biggest and most time-consuming part of this is actually mapping out how all the data flows between all the different systems you have on your network. Now, this is where you're going to spend the most time, and this is where I recommend you spend the most time doing this. The more time you spend doing this, the more flawless your network segmentation will actually go. Now, there's a few approaches we took to doing this. One is we interviewed system administrators to see where data comes from and goes to. This was the ideal case, but more often than not, it was not a usable case. We also looked at a lot of manufacturer documents to see various ports and protocol system uses. In a lot of cases, we were stuck collecting and analyzing NetFlow data. We used VMware Realized Network Insight for some of our virtual machines in the data center. And in a lot of cases, we were forced to rely on things like Wireshark. And as mentioned, spend a lot of time doing this. If you're thinking about zero trust at all, this is where you want to spend the bulk of your time. Make sure your maps are as accurate as possible, so when you put policies in place to segment things, you don't break anything. I will also add that even if you're not interested in zero trust, this is a very worthwhile exercise to do from a security perspective, because if you really understand how data is supposed to be flowing on your environment, It makes it much easier to identify any data flows that shouldn't be existing on your environment. And once you have this mapped out, you can use the mapped out data flows as the basis for creating the zero trust rules that you're going to put in place. We chose to begin our zero trust journey in the data center. You could make an equally valid case for starting at the endpoint, but we chose to begin in the data center at the time. And one of the things about data centers is that we had 100% virtualized environment. And virtualized environments are traditionally harder to secure than physical hosts at the time, because one of the things was, if you had two virtual machines sitting on the same physical host, that communication between virtual machines went through the backplane of a server and never left the server to go through a firewall or other type of network access control device. Now, a few years ago, that all changed when you had software-defined networking products like a NSX from VMware or Hyper-V network virtualization from Microsoft begin to appear in the market. We chose to go with the VMware NSX because we're a VMware NSX shop. And one of the great features of that is, as part of NSX, they have what they call the distributed firewall, which basically allows us to put a little tiny firewall in front of each virtual machine that allows us to put a perimeter on that virtual machine so we can control all the traffic coming to and from that virtual machine, even between machines that sit on the same physical host. So we can secure all the traffic leaving a virtual machine and all the traffic coming into a virtual machine. We chose to do this by starting with our simple, most well-known services first. We did this for things like DHCP, DNS, NTP, various systems like that. It's an easy, low-hanging fruit starting point. It allowed our network team to begin to learn the NSX product. It minimized chance of breakage because the ports and protocols are so well known. We then proceeded to do our virtual desktops. VDI desktops, the great thing about them is within most organizations, VDI desktops tend to be clones of each other. So if you figure out a set of policies that works for one system, you can apply those policies to a large number of virtual desktops and secure a lot of systems with relatively minimal effort. Once we got past the well-known systems and the VDI desktops, we kind of moved on to systems we considered higher risk, because by that point we were pretty confident in our team's ability to use the NSX product. And once we did the high-risk systems, we saved systems that we considered very complex but lower risk for last. And that was kind of the approach we took within the data center. On the physical network side of things, we chose to approach zero trust a little differently. Through that, we did a network access control appliance. And the great thing about network access control is it allows us to create port-based policies that restrict communications based on device type. So in other words, a PC plugged into our network gets one set of policies, a security camera gets another set of policies, a printer a different set of policies, and so on. And this was great because, for example, policies for PCs. We created a PC policy that would allow our PCs to communicate with our server subnet that contained things like our EICAR, our PAC systems, but didn't allow the PCs to communicate with anything else. So two PCs, even plugged into the same switch, they can't see each other. All they could see is that server subnet. And the server subnet was in turn microsegmented with the NSX product, as we previously talked about. So our NAC allowed the PC to see our servers, and NSX ensured that that particular PC could only see the servers it needed to and nothing else. So we kind of used the two solutions together to form that zero trust framework within our organization. And NAC turned out to work very well for any type of device where there was a large number of devices with common needs spread out through the organization. We also do make use of some internal firewalling as part of our zero trust approach. We use these for mixed things. There are a few one-off devices in any organization because of limits on the number of NAC policies you can have. For some of these one-off machines, we did choose to use some smaller internal firewalls. We also find internal firewalling great for securing a lot of medical devices and other stuff because they provide a great way to virtually patch legacy devices. So you can use the IPS functionality in most modern firewalls to act as a way to virtually patch a lot of devices. So that's the approach we took. We also use this to filter communication between various subnets. Now, we put all these policies in place, and as mentioned, really big on empirically measuring to ensure the changes we make. And we repeated the EICAR mock incident. And one of the things we saw when we repeated this exercise was that only the script, only the endpoint in which the script was launched from was infected. Nothing else was infected the second run around because those policies, particularly the NAC policies, which prevented PCs from communicating with each other, actually prevented that infected PC from being able to communicate and infect other PCs. So that was really, really encouraging to see. Now, one of the things we've been focusing on in recent years is I'm really big on defense in depth, and zero trust is a great security control. Very big fan of it. However, it's not a panacea for all information security needs. So one of the things that we've been working on is ways to actually deal with attacks that zero trust could not help us deal with. For example, a web server. A firewall, whether it's zero trust or not, is not going to keep us from being compromised if that attack comes in via port 80 or 443, because those ports have to be let open in order to allow the web server to function as a web server. So one of the things we've been really big on in the last couple of years is extending the zero trust principles to the application level. So we've been doing a lot of work rolling out application whitelisting to kind of take that same zero trust approach, but now at the application level rather than the network level. A big part of this is I'm finding signature-based defenses that match known malware or malicious behaviors are really not sufficient any longer for detecting and stopping threats. I think it's much more time to move towards a whitelisting approach rather than taking the traditional blocking approach towards certain behaviors. So one of the things we did to test some of our application whitelisting technology that we're rolling out is we took advantage of OWASP Mutillidae. It's a deliberately vulnerable web application server that pen testers and other stuff can use to train their security skills. And what we did is we installed XAMPP on a fully patched Windows 2012 R2 virtual machine. We actually created 2 of these, and we decided to go with App Defense as an application whitelisting solution. So one of the things that we did is we had a virtual machine that was running App Defense and a virtual machine set up like this that was not running VMware's App Defense. So this is just showing Mutillidae is installed. It's running on the virtual machine, and that we can access this particular web server. So how the App Defense product works for application whitelisting is you install it for a period of a few weeks in a learning mode on that particular server. And it learns all of the behaviors that that server looks at. If you look at the screenshot there, you can see these are all the services that are running on the virtual machine. So there's the Apache a web service from the XAMPP install that's running Mutillidae. And it also learns all the network communications that this particular virtual machine makes. And you can let this run for a period of weeks. For this test, we did it for 2 weeks. If you're actually doing this product in production, I recommend you run it for a little longer to ensure all the behaviors are fully learned. And what happens is that once you learn all the behaviors, you can put it into a blocking mode, in which case any behavior that's not on this approved behavior list is going to be blocked by default. So to kind of test to show that this product was working, some of the testing we did is Mutillidae, because it's deliberately vulnerable, does allow you to successfully launch OS command injection attacks against it because it doesn't properly sanitize inputs. So one of the tests we did is, as part of the Mutillidae functionality, it allows you to do a DNS lookup, a very simple lookup. The thing is, it doesn't sanitize the input here. All it does is really open up a command prompt, use the DNS lookup command, and give you the IP address for whatever host name you put in. But one of the things we were able to do is we were actually able to take a query, and normally you put google.com in here and get the IP, but we appended the ampersand after google.com. What that does is that allows us to append a different command, an additional command to the end of google.com. So in this case, it's a command to open up Internet Explorer. And if we go back one screen quickly, we can see that if we look at the approved behaviors for this system, Internet Explorer is not one of them. So we use the OS command injection attempt, and we can see now that we're getting a warning that IE was launched and the behavior was blocked because that's not part of the baseline we created for this particular system. So that's some of the work that we've been doing recently to really begin to extend these zero trust principles to more than the network layer and to actually apply that to the application layer as well. We've had a lot of success with this. We're one of the first hospitals in the country to actually achieve a fully zero trust network. We've actually managed to incorporate some cost savings in as well to the process due to the heavy virtualization we accomplished at the same time. And I'll actually give an example of a real world medical device incident that this zero trust network architecture actually helped protect us from. One of the interesting things is we had a hard drive and an X-ray machine within the hospital crash. And the biomed department, unfortunately, didn't consult with IT about this or information security. but it turned out that they didn't have the original software installed disks for this particular X-ray machine. So they decided to clone the hard drive from another hospital's X-ray machine because they serviced the same exact model X-ray machine at a different facility, and use that to restore our X-ray machine to service. It was pretty interesting because they put the hard drive in, they powered the X-ray machine on, put the network settings in, and this is all unbeknownst to information security or IT. And we start getting alerts that our DNS sinkhole is going off. And by the way, for anybody considering medical device security, I'm a very big fan of DNS sinkholes, because one of the big problems with a lot of medical devices is you can't install AV or endpoint security, and a DNS sinkhole is a great way to pick up infected devices. But either way, our DNS sinkhole starts going off as soon as they connect this device to the network, and it turns out the X-ray machine was infected with Conficker. Now, we pulled it off the network within a couple of minutes, but this was a case here with these zero trust policies we had in place. They prevented the X-ray machine from being able to effectively communicate with anything else within the organization, and it helped keep us safe from what could have potentially been a much bigger problem. And for us, all it really made for was a very interesting call to the IT security department of a different hospital. And at this point, if time allows, I'm happy to take any questions.
Thank you very much, Chris. Informative and insightful as always. I always learn something from your presentation. So thank you very much for sharing it.